And public hospitals have been caught in the crossfire between the states and the federal government over health funding. The Federal Health Minister, Peter Dutton, insists his government has kept an election pledge to increase funding for hospitals, and the states knew that some funding agreements were due to expire. But that's been roundly dismissed by the states and some health experts, and they're warning of drastic cuts to public hospital services, as Melissa Clark reports from Canberra.
There's no shortage of people angered by the federal government's budget. Students, pensioners, families. But it's the cuts to funding for public hospitals that has seen even the government's allies turn against it. State and territory governments, predominantly Liberal, are angry.
We deliver the frontline services, particularly in health and education, yet the Commonwealth holds the biggest bag of money.
We're just not going to be able to provide an acute hospital bed for everyone who's South Australia who needs one in the light of these cuts.
The Federal Health Minister is arguing there isn't a problem.
We made a few commitments before the election. One was that we wanted to increase the funding that we put into hospitals. We honour that in this agreement.
He's right that there will be a net increase in funding, but it won't be anywhere near to cover the increase in costs that states will be facing.
Stephen Duckett used to run the Federal Health Department. He says the states and territories are facing funding shortfalls on two fronts: immediate cuts and those that will kick in after 2017. The immediate cuts affect the national partnership agreements, which provide funding for non-intensive care beds and incentive payments for hospitals to meet targets on waiting times and elective surgery.
In the case of the National Partnership Program, they're gone. Both the money for running new hospital beds and the incentive targets, they've wiped those.
It was a defined amount of money for a defined period. The states knew that it was to finish 30 June of this year. Labor Party went to the last election saying that they wouldn't extend that money. We took the same policy.
But state health ministers, Labor and Liberal, say many of those programs were due to continue for another year or two. But the biggest problem for the states and territories is a couple of years down the track, with the federal government axing Labor's agreement for a 50-50 share of funding for future public hospital costs.
They've kept the 45% up till the 1st of July 2017, but after 2017, the Commonwealth isn't going to share in the cost of additional activity. They're just going to say, look, we're just going to pay for population increases and inflation.
From 2017, that means the states and territories will have $1.2 billion less every year to spend on public hospitals.
It means that by 2023-24, the Commonwealth share of public hospital funding will be just over 20%, a fifth of the cost of running public hospitals.
This is the most parsimonious proposal that has ever come forward from the Commonwealth. Previously, when they had population-based adjustments, they would provide a betterment factor of, say, 2% per annum on top of CPI, on top of population, knowing that there are new technologies and so on that are coming into the system that the public expects to be used.
Health inflation is always greater than average CPI, so we need a formula which is just greater than CPI and population increase, or otherwise we go backwards.
The federal government isn't budging.
When Julia Gillard signed the states up to this agreement, she had to throw an enormous amount of money, completely uncosted, to get the state premiers to sign up to the agreement. And we've said that we want to increase funding each year, but reasonably that we want to do it at a sustainable rate.
And therein lies the problem. For the states and territories, it's more than just a funding cut. It's finding their hard-fought negotiations with the Commonwealth count for naught when there's a change of government. And the deal signed with the previous federal government, designed to end the blame game, has been ripped up. And the blame game has recommenced. Melissa Clark, Lateline.